This is One-on-One. Dr. Mary Jane Warden is Acting Chief of Breast Surgery at Hackensack University Medical Center. Good to see you, Doctor.
Nice to see you. Thanks for having me.
Doctor, you are a breast surgeon.
That's correct.
When did you know this is what you wanted to do professionally?
Well, I knew from the time I was in grade school that I wanted to be a doctor. And then by the time I was in high school, I knew I wanted to be a surgeon. When I was in medical school, I realized I was very interested in cancer. And then I did my fellowship in surgical oncology and limited my cases to breast.
It's interesting because there are so many different ways of looking at this, but one of the things you've told our producers is that it's important to have a multidisciplinary approach to looking at breast health and you know, really dealing with tough issues. And you said there's something called a tumor board, and I was just asking you about that. What does that mean, and why is it so important to a patient?
Well, it's a chance for us to present our cases to all the services, so the radiologists are there.
The tumor board?
The tumor board.
Who's on the tumor board?
Well, the radiologists are present, medical oncologists, the radiation therapists, plastic surgeons, the genetics department, plus all the breast surgeons. And we present every case that we've diagnosed the week before and get everyone's opinion as to what the best treatment would be.
How does that change, potentially, the ultimate, I'm not going to say, well, not only the prognosis, but the protocol? How does it potentially change what happens?
Well, you might have a patient who has different possibilities of treatment. They may have a relatively large tumor that you may have recommended a mastectomy, but there's a possibility that they could be treated with chemotherapy to shrink the tumor down and then become a candidate to save their breast, to have a lumpectomy and radiation therapy. So that kind of option would be presented to the whole board to see what the radiation therapist thought, what the medical oncologist thought.
Is the board new?
Oh, no. No, we've been doing that for the past 15 years at least.
Really?
Yes.
Is this whole interdisciplinary approach not new, but essential?
It's very essential, yes.
What would happen, Doctor, if a hospital or a group of clinicians didn't do that and said, listen, I know best and I'm not really going to consult all the way around? What would happen?
Well, in most cases, the patient would probably get the appropriate treatment, but there's some cases, like I said, where there are different options that you may eliminate one option, which would be a good way to treat the patient.
That's interesting. The patients you treat, they're from ages from what to what? Give us a sense. From how young to how old?
Well, we're diagnosing breast cancer now in patients as young as 25.
As young as 25?
As young as 25, yes.
Up to?
Up to 95.
Really?
Yes.
So all kinds of different situations. And what they face, a product of a whole range of issues, age being one of them, right?
Every case is different. Every patient's history is different. Every patient's physical status is different, and every tumor is different.
Some of the issues they face are not simply clinical or medical, correct?
That's true.
How do you deal with the other side of that, the emotional, psychological piece?
Well, it's very important to support the patient psychologically. In many cases, the diagnosis is a shock. The patient goes in, has a mammogram, thinks she's fine, thinks everything went well, and then she gets the call the next week that there's an abnormality on the mammogram and it looks like she has cancer. So it's a big shock to a lot of patients because they feel well. They don't feel ill.
How do you, you know, I always am curious about this. How have you prepared yourself, or can you ever really prepare yourself for that conversation on your end? Because you're the one. You're the one who has that conversation. How do you?
Well, you have to be truthful with the patient, but you also have to give them hope. And in most cases with breast cancer, there is a lot of hope. Breast cancer is very easily treated now.
It is, more so than 20 years ago?
More so than 20 years ago. There are better drugs. We're doing less surgery. We're doing less mutilating surgery. We no longer have to do as many axillary node dissections as we used to in the past. A lot of women are able to save their breast to have lumpectomy and radiation therapy.
Technology better?
Much better.
Research better?
Research is much better. There's more targeted agents now.
What are targeted agents?
Well, the medications that are directed to a specific kind of tumor. So that instead of using multiple different kinds of drugs, you can use one targeted drug, so there's less side effects.
So it's interesting. On one hand, you're being very candid. You're not sugarcoating anything. On the other hand, it's important to give hope because you want the woman to have a good attitude, to eat right, to do what is necessary to help her moving forward, right?
Exactly.
Do you have to be on some level, without the license, a psychologist?
Well, the psychological support is very important, and some women need more than others, and that's also available at our center. We have psychological support for anyone who needs it. We have support groups with other women who have gone through the same thing. And for women who don't want to go to a group, we also have some patients who've been through it,
Right.
who like to guide other women through it and tell them what it's like, and that there is light at the end of the tunnel, that they will get better.
The other thing I remember is there's a celebration. By the way, is Joanna Gaggas our executive producer in the control room, because she produced, she went and produced at the Celebration of Life at Liberty, it was up at the Liberty, not Liberty Science Center, but Liberty State Park. There was a Celebration of Life that she went up there and produced. It was a great half hour celebrating in connection with your organization, with Hackensack. It's incredible women. And I'm thinking to myself, so many of these women are so strong, and that positive attitude is important. But the other side of that made me think about prevention. How important is the prevention piece and education? Because a big part of that event had to do with education. Are women smarter now than ever before with respect to early detection?
Well, there's been some mixed signals coming from the government with the...
Mixed signals?
Mixed signals, because about 2 years ago, there was the United States Preventive Task Force that recommended women not get screened until after age 50, and then only every other year.
What do you think?
I don't believe in that. I still recommend that my patients get screened at 40 and every year.
40? Okay, your recommendation is 40 and every year.
Every year.
Because?
Because there are some cancers that grow very rapidly, not many of them, but some of them do, and a certain percentage of patients will have what we call an interval cancer, so that they'll have a normal mammogram in 2013 and they're screening at 2014. There'll be a cancer
Better
there.
be safe.
Yes.
Thank you, doctor. Important information.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by Activists in cooperation with the American Medicine Chest Challenge, Choose New Jersey, NJIT, Health Republic Insurance of New Jersey, the New Jersey Education Association, PSE&G, committed to improving New Jersey's economy and strengthening its communities. And by the Healthcare Foundation of New Jersey, transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.